98,000 preventable death each year, with an associated cost of about 17 to 29 billion dollars. What happened to my slide? All right. Let's see.
Start, go up there, so from the beginning, and that'll begin, no,
Okay.
yeah, there you go. Now just click on the next.
All right, thanks. All right.
You already did that one. Just pass that one.
That's
There.
okay. And this is my Piper question. In hospitalized patients, how does technology-assisted medication administration, such as barcode, compared to traditional administration practice, affect medication errors during their hospital stay? I reviewed about 3 articles during my research, and all 3 of my articles show that the use of barcode technology decrease the incidence of medication errors if followed appropriately. This particular article, they conduct this in 2 hospitals, and this is just the results that it showed. One of the hospital, about 775 patients, 153 medication errors before the implementation of barcode technology. And the other hospital, which has about 690 patient, 60 of those, medication errors. So altogether, after all the implementation of the barcode technology, it showed that about 56% reduction in medication errors. So that's huge. As nurses, when we go to work, we don't plan on, giving patient the wrong medication. That's why this is, I'm passionate about this topic, because when my son was very little, he always had seizures, and he was at Brooks, and they gave him more medication that he was supposed to get, which kind of put him backwards. But it's good to know these things. And these are the risk factors, for medication error. Excessive workload, you go to work, you're tired, you don't have much time to look at the orders or that kind of thing. All this, causes medication error. Labeling error. 2 weeks ago at my job, we had the same problem. A patient came with acute COPD exacerbation, so they order, I think it's Brio, one of those medications to help them. The label says one thing, the medication that was in the package was something else. So for 2 days, the nurse that had that patient was giving him the wrong medication because she was scanning just the label, which is, maybe not her fault totally. But then the 3rd day, another nurse came, removed the medication from the package and scanned it, and it was indeed not the same medication that he was supposed to get. So she get a write-up, and the nurse manager have to put a ERS, for the pharmacy and all that. But, it just takes little time, if you could, we all learn. So I always try to take the package out and scan the medication itself. And this is similar to what we use at work. Again, when this system, it just gives you a set of extra eyes, to make sure that you verify the patient. You scan you have to log in first as a nurse, and then you go into the patient's room, you scan them, you ask them for their name and date of birth, you scan all their medications. And this system, it's so good that it just tells you everything that you need to know, so you don't make a mistake while you're giving a patient medication. It also identified the 5 rights of medication: the right patient, right med, right dose, right route, and right time, and even right documentation, because once you sign it, you have your documentation right there. And this is just an example of, where I work. When you scan, this is what an EMA looks like. So it tells you the patient's medication and all. And then this is just one of the alerts that usually comes up, which sometimes we tend to ignore, but this is just part of the system, trying to help you not commit, a medication error that will cause somebody their lives or, some sort of bad reaction. This particular one, the patient that I have, and she had two doses of gabapentin. One was 400 milligrams and the other one was 300 milligrams. So once I scan one already, it's there, and I scan the other one, it's just telling me that, are you sure? It's trying to make sure that you are giving the patient this medication, all of it. So you have to just verify and move on. And also this one is Solmedrol. The patient gets 60 milligrams, but the vials that we have, they all come in 40 milligrams, which is 1 ml. So it just tells you that, hey, are you sure? It shows the red there, that make sure you pull the medication and waste whatever that you're not going to use right there when the pop-up came, so you're not accidentally pulling all that medication and giving it to the patient. And this is just nursing interventions using, again, you just scan the patient's wristband, you ask them for their name and date of birth, you verify the medication, including the right drug, right dose, and right time. You should always not try to do walk around from this system. You have to make sure you follow directly what it's telling you, instead of say, oh, well, I'll come back later. I love this system. Like most of the other patient that comes in, they have a lot of pain always, and some of them, you'll give them their pain medication before. When we don't have the system, they'll say, oh, I have not received my medication. But no, I go there, I bring all my medication, and I stand there, I ask you for your name and date of birth, I scan, and then I said, I'm giving you your pain medication. So right there, you scan it, it's there. So you cannot tell me I did not, because I was just there, and it shows you exactly when you give it. So again, at the patient's bedside, that's when you administer the medication. Make sure you do not remove more than one person's medication, because that's where medication error do occur sometimes. You say, oh, I'm in a hurry, I might as well just pull Mr. This, he's right next door. No, don't do that. Just get that patient medication, go there and give them, and it's quick, it's easy. Scan them, administer them, and you move on. This slide right here, I think it's very interesting to me, where it says where medication errors occur. And it just shows, this is a physician, the pharmacist, and the nurse. The physician do the orders, send them to pharmacy reviews them, and then it gets to us. But for the most part, it says here 39% of the errors occur when the doctor is writing the orders. But then again, when it comes to the pharmacist, they catch, but most of the time, 50% of those errors, they do catch them. And then when it gets to us, 38%, because we say, okay, that's the order they put, and we just give it. Most of the time, that's what happens. And again, this is just another slide. Of every 100 of those errors, 20% reach the patient from the doctor's mistakes. And then 6% of those reach the patient from the pharmacy not maybe reviewing everything like they're supposed to. And here it says only 2% that we caught, so that's really bad. So it goes back to, paying attention, making sure you're following all the steps so you don't give a patient the wrong medication. And this is just the guidelines and recommendation for the barcode system. The provider dispense and administration. It's a system where I think that every hospital or healthcare should implement this system. I know it costs money, but saving somebody's life by giving them the right medication, I think to me, surpass everything else. So when it's recommending that the pharmacy, they should scan every ingredient that they're gonna put in that medication, so they know exactly what's going there. And every unit dose, they have to make a unit dose and not like before where you have to count pills. So they are all individual pills. You scan them, and like I said, I love the system because even I've seen where medication expired, and I would take it there. Well, not that I know it expired, but by just scanning the medication, it would tell you this medication had expired. And I had to go back to the Fixes to look, and they had maybe 7 more expired medication, and I have to go to pharmacy because we have a pharmacist on site, and I say, hey, can you go check this? And she said, I don't know how this happened. Well, it did happen, but so that helps, to fix it. And again, this is just all the guidelines. Like I said before, just take the medication. One person take their medication, scan it, go to the next patient, and from the time the patient entered to the hospital, they give them this unique identifiers for the barcode that, okay, they only give one person one unique identifier, so they're not going to make mistake by doing that. And why is this important? Because if used effectively, increases the patient safety, serve as an extra assurance for the patient satisfaction. Barcode technology reduces opportunities for medication error. So all around, I think it's a good system, and this is just a thing that I found online that says if you consider that one medical error results in significant cost to the organization, you realize that every error avoided actually pays for the barcode scanning solution. So, and my reference. So, anybody have any questions I can answer?